So today there were 2 chapters we talked about, and I want to be, and some people say that the quiz was a little harder.
Way too much harder.
Way too much harder or way harder?
Way harder.
It was really hard.
It was really, did you do okay?
No.
Well, the 4th attempt.
Really?
I got a
Or
7.
the 3rd attempt.
Was it like, did I do write-ins yet or just
It
most?
was more trying to figure out the pictures.
Huh?
Yeah.
Well, so now let's go through it. Well, some was wrong, right? Yeah, that's why I didn't have time to go through the wrong ones. That's why I just go through the whole thing. So we're going to do it while we go through sort of the material. So over there I'm going to put that up. So joints are connected between bones, muscles attached to bones, and when they contract, they pull. And then this is how we can move around in this world. What is the process of self-propulsion in an animal called? Locomotion. So you got that, right? Good. And that's right here. So that's what's important about that. What we need to know is, on this slide, is locomotion has both 2 systems involved. And one system is the skeletal system, and that's the passive, that's the bones and the joints. Where bones come together are joints. And then the active system is the muscles, the skeletal muscles, and the tendons, which the tendons are parts that attach a muscle to a bone. Tendons attach a muscle to a bone. Ligaments attach bone to bone. So that might be good to know. Did that come up here in the video? So tendon is muscle to bone, and ligament is bone to bone. Because to your eye, it looks similar.
Wait a minute.
So if someone says, I twisted my ankle, I twisted, all my ligaments are broken. Now all these ligaments, they were just torn. Because they attach bone to bone. And then often also, when they walk, this muscle out here behind the fibula gets really tight. Or even though they don't walk, it just is really tight. And then underneath that muscle, there's a tendon that goes underneath the foot, and then that also is involved. But that will be the tendon versus the ligament.
I got a question. When you get a cramp in your leg,
Huh?
how does that play a part?
Well, that depends. I mean, you can have a cramp in the leg because if you, let's say, you twist your ankle and that muscle is overstretched and then it tries to work, it's too much and it gets crampy. That could be one reason. Could be dehydration. Could be an array of things, but that could be one thing. If you have an overstretched tendon, no ligament. So if you twist your ankle, you have an overstretched ligament. We call that a sprain. We might as well just say that now here. We call that a sprain. If we have an overstretched muscle, we call it a strain. So they often call injuries like a whiplash in a car accident with a head slams back and forth or something like that. They call it a sprain strain injury. Or strain sprain, but that's what they refer to. So if you want to be specific, a sprain refers to ligaments, a strain refers to muscle. All right, but that's for that. Let's see what number 2 says. Joints are the most vulnerable parts of the skeletal system. That is correct. They often break easier than bones do. Yes. We categorize joints, and then we often break ligaments when we sort of break the joint or we injure the joints. And if we break ligaments, like in a foot, that can leave a foot much longer unstable than if we broke a bone. Bone heals faster than ligaments do. Because the reason for that is ligaments don't have any blood supply. Ligaments have no blood. Bone has good blood. We'll talk about that when we talk about that chapter we didn't talk about. But that way, at least you know that. Bone has good blood. So if you have good blood, things heal nice. And you think a joint, you think of a knee joint. And then you got these ligaments around and you got the cartilage on it. If there's so much force going on, if you got blood vessels there, you're going to bleed all the time. So you got to, that's sort of the way you're thinking it. You got to make, does it make sense? Why wouldn't it make sense? Oh, well, because you're going to squeeze all those blood vessels, they're going to break all the time. That would make sense. So there's, those are the reasons why there is no blood supply in those tissues that need that have that force on it. A bone's very strong. Bone holds you up. We can drill a hole in, put a blood in there, it's all good. It's like a whole house. It's a tower, it's that strong. Okay, anyway, so what would the thing here be? Joints, we categorize joints by how much they move, by what kind of material we enforce their connection. What is the prefix we use to describe joints?
A word.
The A word. Well, not that A word. The arth word.
I cannot see.
Arthritis or
Can we move into like that one? It's so tiny.
Huh?
Can we move that or make it bigger?
No, I know. I can't make it bigger. I know. That's why I'm reading it. I know. I'm sorry. Look at this one. So the arth means joint. There are connections between bones. We said that already. We need to categorize them. We categorize them by how much they move and what kind of connections they have. Some joints don't move.
This one I had trouble with, number 3.
Well, let's go for it. When we think of a joint, we think of one that moves freely, like a finger joint or a knee joint. That is only one type of joint. However, we have many places in the body where bones come together and there is practically no movement required. Syn means together. These types of joints use different types of material to form strong bones. Choose all the different types of tissues that create synarthroses. All right, first of all, syn means together. So those are the joints that don't move. So that could be like the pelvis has multiple joints that make up a hip bone. They don't move. So that could be a bony fusion. It could also be the tooth going into the tooth socket. That's a joint, a bone coming with a bone. It doesn't move. Hopefully, it moves a little bit, but not much. That would be another choice of a synarthrosis. Then we have some joints that move a little bit. Like here, you got some joints that move a little bit, but they don't move freely. They move a little bit. There's cartilage and then some joints. And then we got joints like these joints. They move a lot. So those are sort of our main categories. So let's go to the next slide, and these are choices here. So syn means together. So the question is, what are these synarthroses made of? And one is a bony fusion. Let's hope I'm gonna get it right, huh? That is fibrous tissue. Yes, that's in the, like sutures in the skull, for example. And then we have, what do we have? Cartilaginous tissue. That's also here. Cartilage and bony stuff. Ligamentous, that will not be. Ligaments go over joints like a knee joint. So those are freely movable joints. That's why we need ligaments to make sure they don't go too far. The reason you have a ligament, or well, if you look at a joint that's a freely movable joint, we get to that in a minute. But you're gonna have bones come together and they move all the time. So you're gonna have a joint capsule that closes everything in, and inside you got a fluid. Because if you don't have fluid, it's like you're taking 2 bricks and you're grinding them. You need cartilage and you need fluid to make sure it's nice and soft and smooth. And if we're old and have arthritis, we know what it means when it's not nice and soft and smooth. That's after 40.
So when it has arthritis, it's limited to the liquid in there?
No, not necessarily, but the bone regrows. The bone adapts and grows out a little, and then that can be a problem with the motion amount you can move. And then, yeah, you definitely have the cartilage deteriorates. And so you can have liquid issues, but liquid's usually too much. A lot of times liquid's too much, and it grows out like a baker cyst or something, and you got a problem like that. Yeah, right? So that comes up sometimes. But well, I forgot what I was going to say. But that's where you need ligaments, because when you think of moving freely, so then you have the joint capsule, and outside of the joint capsule, you got ligaments that attach to the bones. And in the knee, for example, you got a ligament on the outside, you got one on the inside, to make sure the knee doesn't go this way. To make sure it just goes this way. Because you don't want that knee to go that way. You want it to be stable. So if you get a real big force, jams you this way, it's going to break this ligament. So you have these ligaments to guide the motion and to hold the bones together.
So it's protecting the bone.
It's protecting the bone, but a ligament works on a freely movable joint because of that. So that's where ligaments come in. That's the one that I don't want. And tendinous tissue also, because that's a muscle, the muscle to the bone, right? And that's also tissue that is more in a freely movable joint, because you gotta be having muscles moving the bone around, and so tendons go into the bone from the muscle. So that's not, that might be a little difficult question. I don't know. Let's see if I get it right.
Yes.
Make a mistake, huh? But did you get it right ultimately?
No, and I tried 5 times. I didn't get it right. That was what I had a challenge with.
Well, let's see if we get it right together, huh? Did anybody else get it right? Good, so it was the right answer in there somewhere. Okay, so let's go to the next one. Some joints are said to move a little. For example, in your low back, at the butt level is the pelvis, which is, that's an interesting joint. The pelvis, which has 2 joints posteriorly that rocks back and forth, but are very limited in terms of motion. They are much better at transmitting forces. What is that group of joints called? The A, amphiarthrosis. It's like, in a Roman thing, an amphitheater. You know what an amphitheater is? It's a half theater. Amphi means a joint that moves a little bit, like a half moving thing. So amphiarthrosis, that's the term here. But this is interesting. So you wouldn't think it took me this long, but I have a scalpel thing at home, and I screwed apart the bones, because I just wanted these bones and not that whole spine with me, and I had to put the bar in, so it's. But I saw the ridging, the amount of ridging inside these bones between the sacrum and the hip, and it was like spicules, like bony, pokey things sticking out. And you just imagine that bony, pokey thing sticks out here and goes into here, and you're gonna have a little twisted butt or something. That's gonna hurt.
So if you reach back here, can you feel it?
You can't feel the punky bony thing, the spiculy thing, but you feel this bump. We're gonna work on this bump. No, that's next week. Next week we're gonna talk about the bump. But what it made me understand is in that amphiarthrosis, in that slightly movable joint in there, this rocks a little bit. The pelvis is, the movement, you're rocking from here. You don't walk from your butt, but your butt a little bit, so, you twist the butt. That moves a little bit. So that's what goes on in here. The leg motion, that's in here, and the femur. But these joints in here, so they move a little bit, but just rocking. It's not more than that, very small. Right? And part of the joint is freely movable, and part of the joint is this amphiarthrosis. And that's what I mean. What I found was these bones are so pokey at each other that if you have a little bit of an unevenness, let's say you have a car accident, you get a force that comes into this leg because you're on the brake and somebody slams you from the back. It goes all the way up. It jams you. That disrupts here. That disrupts in here. That can cause a lot of pain. Sacroiliitis, they call that. But I wasn't aware how severe it can be. I see it all the time, and I work the pelvis, make sure it's all nice and stable and levels, and all the pain goes away. I see that all the time, but I didn't expect it to be that extreme, because I never seen the joint like that on the inside. It's those pokies. Anyway, that was that question, huh? That was easier, wasn't it? Nope, that was, which one was wrong? Most of what we study in this class, however, are freely movable joints. Consider your knee joint as we walk. It constantly bends and straightens back out every time you take a step. So you've got to be grateful for your body, huh? That's pretty profound. I mean, that's like, I know you're young, you don't understand, but some of us understand when we're young, because my back was a pain in the back at 17. That's why I became a chiropractor. I'm still looking for help. Any help? So it constantly bends, straightens out. The 2 bones that meet will need protection, so we don't rock the bones further porous material against one another. What is the protective material called?
Cartilage.
Cartilage. Everybody got that?
Yeah.
Good. That was okay, yeah. So if you have, oh look, there are the joints. There we go, cartilage. Hyaline cartilage.
Was this
We-
one a problem?
Hmm?
This one was a problem.
Oh, is that number 6 was problem?
Number 6. What-
All right, let's see if number 6 is a problem. We have nourishing liquid inside these joints that help lubricate them. What structure helps that fluid in and prevent the bone from separating during use? I guess I had a little morning brain fart with writing it that complicated, but it's still doable. What is it called? It's a joint capsule. So we have the joint cartilage. We talked about that. See, I just put this picture in. I like these pictures. See, this is kind of cool. So a joint cartilage, the hyaline cartilage, is a... Have you ever eaten something bitten on a cartilage?
Oh, yeah.
It's like, that's why I can't eat spaghetti bolognese anymore. Or hamburgers. But anyway, it's like squishy. And so you want that material to be squishy because it's like at the end of the bone. So if you have squishy material, you can squish it a little bit and it doesn't deform, it doesn't grind, it's very liquidy in there. And so you have these molecules that are proteoglycans, they call them. Protein and glycan means sugar stuff, so they're these long molecules. And they look like bristles. You know bottle bristles? They wash a bottle with? Bottle washing bristle thing? Oh, baby brush? Yeah. They look like that, and they in between those bristle things, they attract water liquids, molecules. So they're water trapping things in there. So these are water trapping things. So you got a lot of those water trapping things in there. So when you squish these bones together and you put these 200 pounds on top of one another, you know when you walk, each knee has to have the whole weight. And then you come down with a weight, then talk about how heavy that is. It's about double. So that's some deep stuff. And even going down is even harder. Because then you got to step, so you're coming down this more. So that's even harder. That's why when you go hiking, the up, your knees are okay. The down, your knees get yanked. The up, your knees get tired because you're walking. But the down is really the compression that does it. So I walk with poles. Then in the down, I use my poles to balance out a little bit. Because I like to hike, so I want to hike a long time. But this material, you understand why that needs to be avascular, meaning no blood supply. Avascular means A means without. Without anything. A means without anything. Vascular means blood. Well, it means blood. Yeah, it means vascular, the blood stuff. So again, if you think of this stuff getting squeezed every step and you have little blood vessels there, it's too much bleeding. Wouldn't work out. So that makes sense why that's avascular. Whenever something makes sense in anatomy and physiology, you kind of go cha-ching, because then you understand that. Or at least I do. That stuff I understand. It's easy to remember. Don't question something too heavy if it makes sense. And then the other thing, and this is where the arthritis comes in, cartilage, articular cartilage is not regenerative. When you break it, it kind of goes away. It says, bye, I don't like you.
You said when you break it what?
Yeah, it's not regenerative. So it doesn't regenerate. So if you tear it and you injure it, it doesn't just heal
break
up.
your ankle and here it doesn't repair?
No, and ligaments and tendons and stuff, we can work on that. I mean, tendons can be hard. Tendons, muscles can take over the work for tendons. But the articular cartilage is hard, you know, because once you have impact, especially banging impact, it kind of kills you a little bit, and then it can get arthritic in there. Like people that have behind a kneecap, for example, that's often one for the tracking. But anyway, and so then that's the joint capsule. I think that was that answer, right? Joint capsule, good.
Yeah.
So the joint capsule, you can see that the two bones come together. We've got the cartilage, and then around it is this strong joint capsule. Some of the joint capsule makes the fluid that is in the cartilage. It's called the synovial fluid.
So now what's the difference? Because that's what I picked.
What? Fluid?
Yeah,
Well, the fluid is the liquid. Right, let me hold on a second. Joint capsule lubricate them. What structure keeps that fluid in and prevents the bones from separating during use? What keeps it in is the capsule. The fluid itself is the fluid.
Okay.
That's what, yeah. But that one you got wrong, you got right over time, right? Where you choose every one 4 times, and that's what the one with multiple answers is a problem. That's more of a problem. So, but that makes sense. So this joint capsule makes the fluid that's on the inside too. It's called synovial fluid, and that's why this whole joint is like a synovial joint. We can also call it that.
Synovial.
Oh, look at that! Isn't that a cool picture? I know. I was so happy when I found this picture on Google, and then I wrote a few things in there because this is kind of all you need to know about these joint things, like in terms of motions, which joint does what motion. That's pretty much, you know, when it comes to that question, that's pretty much what I go by when I have to think a little bit, like how big a motion is or what direction a joint makes a motion in, and then we have these descriptions for it. So let's see what the question is. All joints require different types of movement.
That's gonna be on the test.
That?
No, this stuff that we're going
The
over,
big
is
test.
going to be on a big test?
No, that's why the quiz was so hard.
Okay, awesome.
Oh, is that the right answer?
No, it is the right answer.
Oh, good. That's the right answer. No, I can't do too much pointing. You know what's that called? So and a lot of the chapter that's coming right now is all in motion, which is the setup for muscles. So that's why. By the time we talked about muscles, we got enough of those language things in there. But anyway, let's do it. A shoulder, for example, needs to move freely as possible in all directions. This quality comprises stability, making it more vulnerable for injuries. That makes sense, right? Shoulder injury, frozen shoulder. Anybody have frozen shoulder before? Anybody know somebody with frozen shoulder? Come on, you're that young. Nobody frozen shoulder? Well, anyway. Oh, well, oh!
What is it?
When you can't move a shoulder anymore. It's frozen.
Oh,
It's stuck. Those are people, they go like that. They go like that. They can't move this like, they can't move that. And see, a shoulder is really cool. If you look at a shoulder, look at that thing. I know, you gotta appreciate these parts. A shoulder has an arm that's attached to the shoulder blade, and then the shoulder blade is anchored into the rib cage. So that's where you got that axial skeleton, and then the appendicular, the appendicular skeleton comes on top of it. And so when you move an arm, you move the arm around here, that's cool. But then when you go up here, at some point, the shoulder needs to move. And not just the arm. Make sense? Because the arm stops. But so that is a lot of movement. And if you, I mean, how many grocery bags can you carry? A lot. I mean, if you think how much abuse you give this damn shoulder, it's not nice. But, you know, we gotta do what we gotta do. Or, I mean, today, one of my new patients, she's got a baby. All day long. You guess what? That's gonna pull on that arm, and it's gonna pull on that shoulder, it's gonna yank on that rib cage, it's gonna yank these muscles. People have headaches. It's not just a lack of sleep. You know, never mind. And then you start talking about, you know, the hospitals and they don't help. It's like, oh, sheesh. Anyway, so that's the shoulder. It's very, very flexible, but prone to injury. I don't know if that was the question. I wanted to talk about that when it came to the shoulder. Vulnerable to injury, but very flexible and very strong. It's very strong, but it's vulnerable. Compare that to the hip joint, which is the equivalent in the pelvis, which is more concerned with stability and therefore loses some of its flexibility. That makes sense. You cannot, I mean, you can do this with the hip and you can do this with two, but you gotta be, you know, Simone Biles at some point. You do it with the hip. You can only, I mean, you know, it's less. So this is nice and free. This is just like ball and socket sticking in there, so the motion is more limited. But you got strength. Got a lot of strength. You gotta hold this whole thing up with these joints down in here. That's a lot of strength. A finger joint, for example, is basically needs to bend and straighten out. Choose all the different types of synovial joints that apply.
Plane, hinge.
saddle, hinge.
Plane.
Everything but a rope.
Plane hinge.
Saddle and hinge. Oh, that. Saddle and hinge. Is that correct answer?
Yes.
Oh, good.
What? Everything but rope.
Yeah, because there is no rolling joints.
Yes.
And that was not a 420 joke. I just noticed that right now. So these are all the different joint types that we mainly talk about. And that's just, you know, a list for them. But I'm not gonna really go too much into worrying about you memorizing which does which, because it's not on the test. You can remember that by looking it up. That's why I try to make it so I wrote it right there, what is what, so later on in another class, which a big old fat list. Some of the things I try to do with the booklet is try to take that information, there's a lot of information in Bio 2 class, and bring it down to sort of the minimum. You might not have all the needed detail, but you can always go back up and look for the detail. But it's easy to understand some of the depth we need to know to be able to build a tree of understanding of this topic. But a lot of it we can use regular terms, we can talk about how it is, and then we can plug in the complicated terms afterwards. Because knowledge is not based on terms, knowledge bases on understanding. And so that's what this class is a little bit about, some of it at least. We'll see it in cranial nerves and so forth. So these are all the ones that I like the picture, and so I think, well, that's why I chose that one. It's very comprehensive. And of course, since all these different joints do different motions, we will give the movements their own names. Bending an elbow, for example, is called flexion. What do we call it when we straighten it out? And that was wrong? Oh, well, there you go. I got to fix that.
All right.
Hold on. We'll do it in real time, then everybody should get a point. Come on, unless my computer's out of battery. No, it's not. It shouldn't. Quizzes. What quiz is this? Joints. Oh yeah, man, I put that adduction on. Huh. I am wrong. So everybody have extension?
Yes, well, that's what I had. Yeah.
Good, give full credit to everybody. Okay, so that was that, huh? I'm gonna get it wrong too.
That is cool.
So you got the extension picture? And the flexion picture. So that's flexion, that's extension. We go use that all the time. What motion does a muscle do up here in the front? Well, it flexes the shoulder. Here, well, it flexes the elbow. If I ask you, because when we do muscles, we're going to go like, well, who do you think makes what motion? We got to do this to the hip. Who do you think is going to do this motion to the hip? Muscles in the front or muscles in the back? This is the motion. Muscles shorten. The only thing muscles shorten, the muscle's going to have to be in the front and lift up that thigh. The back muscles will lengthen when we do that. The front muscles will shorten. So if you ask for a motion of extension on the hip, it's going to have to be in the back. If you ask for a motion bringing the hip out, it's going to have to be on the side here. Bringing the hip back in, it's going to be somewhere in here. Bringing it in, pulling it back in. Does that make sense? A little bit? No? Well, we'll get to it a few times. But for right now, what's the motion called? Whoa. The next body motion is spinal extremities. If we move away from the body, it's called abduction. What is it called when we bring it back to the body? Adduction. So the way I remember that is abduction versus adduction. Adduction has two D's, like in adding a body part back to the body and bringing it in. So that's how I remember it. AB is out, AD is back in. Now, who knows who made these up? I don't know, but we gotta live with it. Do you understand that? I mean now it's automatic after all these years, but for years I was having to give me the mnemonic. An interesting movement is turning the palm in the hand up. What are those movements called respectively? Wait, up and down. An interesting movement is turning the palm of your hand up and down. What are those movements called? And supination. Palm up is when you hold a bowl of soup in your hand, a supination, a bowl of soup. Palm down is pronation. It's just the other one. Supination, pronation. Let's hope that was correct. Okay, so that's that. Rotation. You got rotation, right? Yeah, well, it's not a question, but that is in the book, right? That's in internal rotation, outward rotation, or outward or external, sorry, internal or inward rotation. Then pronation, supination is right here. And then we got the ankle thing, and I'm sure that's here. That's called bend. As lastly we look at the ankle, it mainly moves toes up or down. It can also bend inward or outward a little bit. We often twist our ankle with the sole foot pointing inward. What is that motion called? Inversion. Right here. That's how you twist your ankle. It's very hard to twist the ankle the other way. Have you noticed that before? Who twisted that this way? It's really hard to twist this way. You kind of have to have a force coming from the outside.
Mine would be.
That's exactly the inversion. That's everybody brings it that way. Oh, you did too. I do not know how you guys walk in high heels. That's a total. I'm not understanding that. Okay, so then this brings up. That wasn't too bad. Was that part of that was bad? Oh, this one, opposition. We do not have many animals that can do that have opposable thumbs. If you have an opposable thumb, you can do a lot of stuff. If you don't have an opposable thumb, try to do a lot of stuff.
Just these four.
It's really hard. It's really hard. It's really hard. Most animals do this. That's why most animals don't walk around with hammers and nails and build houses, because they don't have an opposable thumb. Look at that is a miraculous thing that got created for us. And I mean, when you look at the muscles in the hand, they are crazy. Let me show you the muscles in the hand real quick. Maybe. That's my little app I work with in the office. Upper body, fingers, anatomy of the hand. Look at these hand muscles. That's all the hand. This here is the layers of the hand muscles. The top layer and all the way down to the flesh. This is the thumb. This is the different layers of the thumb. Isn't that crazy? That's like so many things.
Well, we need to learn that.
No.
Oh,
In Bio 2 you do. No, I made this for myself so I know where to go when I have to work on a patient, because I don't remember all this stuff. That's why it's my cheat sheet. This is my cheat sheet. I made a cheat sheet. These are all the muscles. Then I have different tests, and then one doesn't work, and just like, Then I got to figure out, and so it's complicated. I'm not that far advanced yet. I'm working on it. Okay, so that was joints. Let's go to the next one, and that would be axial skeleton and movement of these things. And so that's where the spines come in. So let's see. This brings us to the bones that make up the trunk. Basically, the spinal column, which is the rib cage. Looking at the spine, we find the top, neck portion, the midsection, and a low back area. Can you give the anatomical terms for those three regions? Good. So neck, thoracic, mid-back, neck cervical, neck cervical, mid-back thoracic, low back lumbar. And then when we look from the side, we got these nice curves. You see these curves in here? It should be like that. Like that. Over, like that. So the curve on the bottom here is called the lordosis. And the curve in the middle is called the kyphosis. It's not on the text. Thank God. But it's like stuff that, will come back. But kyphosis, lordosis. Well, it's interesting. When you're a baby in the womb, you're laying in there like that. So that whole thing is a kyphosis. And then when the baby, first, when the baby comes out, you hold the head, right? Please, everybody remember that. And then at some point, the baby doesn't flop the head no more when you don't hold it, which is not a good thing. And then the neck muscles get built. And then when that process comes, the neck lordosis will be made. And then at some point, the baby starts walking. And it's okay if it's not tomorrow. It's not a competition. Because if you force the baby to want to walk too soon, it's not ready for it. Because when it's ready to walk, then this lumbar lordosis comes up. And it's not a rounded thing anymore. The baby doesn't walk on it's like that. You know how much that hurts when you walk like that? We wait and it slowly gets developed, and then the baby normally not. Sometimes it goes off a little bit, but normally it just walks by itself. So that's what those curves are, and those are the sections of the spine. So let's see if that's correct. Femoral, what does femoral refer to? And scapular is the shoulder blade, the scapula. Looking at the spine from the side helps us to make up the three distinct curves. Oh, look at that. The midsection bends back and the top, bottom forward. Primary curves are describes the ones that baby develop in the womb. So that's the kyphosis, it's the primary curves is in the womb. Secondary curves form later when the baby holds up the head or starts walking. Which section do we find the secondary curves in? In the neck and in the lower back. So that would be the and lumbar. Good, you guys are good. That must be boring. Cervical and lumbar. And there, I like this picture actually. It has all these terms on it. And then you even got another, look at this, a convex. Oh, for us, convex is kyphosis, and concave is lordosis. You don't need to remember that, but if you write in the booklet, you know for later. Because the term convex and concave, I never remember that. I had to have my mnemonic, and it was a stupid thing. It's like, if I look from the back, so that is the back. This is the back, this is the front. A concave curve is like this. It's like I'm walking into a cave. That's how I remember that. It comes back with eyesight. That's which is the bending is the lens, is it concave or convex? That's where it comes back. But so you don't need to worry about it for the test. The lumbar curve is also a concave curve. All right. So let's see. All vertebrae except the top one look pretty much alike. They all have a centerpiece called a body with two pillars sticking up that form an arch in use. The arch actually forms towards the back or posteriorly. You got that, right? This vertebra, I once had a student and she looked at these pictures and go like, and couldn't get it. And she's like, that is such a stupid picture. I'm like, really? So, the vertebra in the picture looks like that. In the spine is like that. All right, so the body is the piece in the front, in the spine. So you're gonna have some muscles, when we get to muscles, they attach in the front of the spine. Especially down here. That's the front of the spine. And so, let's see what else it says. They actually forms towards the posterior. The bump you feel in the back are the outermost tips of each vertebra, vertebral arches. The spinal cord runs through the channel that is formed by stacking the vertebra on top of one another. You got that? Good. Good. Can you name the four main pieces that make up the vertebral arch? Choose all that apply. Let's see. So.
I thought it was all of them. It's wrong.
Yeah, it is wrong.
The L word and P word.
So see, here's the arch. Vertebral arch. From here to there. So that's the base. So they don't call the body on it. They just call the pedicle, the lamina. Sometimes they call the spinous and the transverse also. But that's why I didn't put those in, because those are sort of more like, yeah. But the vertebral body is not considered part of the arch. I know, that's a tough one from that. And I might not have been that clear in the video. Oh, of course, I think I'm clear about that. And the foramen makes sense, that's the hole. The foramen, when you see the word foramen, you always know it's a hole. The foramen is always a hole. Yeah, it's good to know those. Those are good flashcards. Foramen is always a hole. A condyle always makes a joint. We even have something called an epicondyle. We'll talk about that when we get to it. So that I think brings us to the atlas and the axis. And the question is, the top vertebra is a ring structure, bounces the head. It's named after the Greek god who carries the world on his shoulder. Can you name it? What is it called? The atlas. That's the god down there, right? You saw that. And then the second neck bone is also unique, evolutionary. It absorbed C1's missing body. So you look at this. This is a ring. It doesn't have that friggin' body. Where is the body? There is no body. Every vertebra has a body, except for the first one. And so the first one's body broke off and it became this little stump. Because when you have these models, you put them on top of one another somehow. There you go. You see, that stump becomes the body of this ring. It's not called the body though, but it originally was sort of like that. And that is called, what's that stump called? The dens. Dens, the dens. Dens means two.
Yeah, dens, yeah.
And then we get to the neck vertebra. Overall, the neck vertebra. There's a couple of features that are unique about the neck vertebra. And I mentioned some, I think somewhere. And what's the uniquenesses of that? The spinous process is bifid, and we have a transverse foramina. Those are specific. So when you think of a spinous process, it's the backbone, the bone that you can touch, the bone in the back you can touch. And that bone here is bifid, means it splits in two. It splits in two. And the reason why it does that is when you take the head back and you bring the head all the way back, if it doesn't split in two, these bumps, they touch each other and they're going to limit your motion. And so if it splits in two, the top one can sit on the bottom vertebra that way as it goes into full extension. So that's what this is, this bifid process. So that's what that means. The spinous process is forked. And then the other thing that's unique about this cervical section is it has a hole on the side. The transverse foramina. Again, the word foramina means hole every single time. And that's where the red thing goes up and down. And the red thing is a vertebral artery. And the vertebral artery gets blood going into the back of the brain, and the back of the brain goes up into the skull. And so that's why the neck is the only section that has these holes on the side, and has the spinous here is just a little bit bifurcated at the bottom. All right, so that was probably a little bit of a harder question, huh? Mm-hmm. I know. Watch out, later on you got to write in stuff. And I wasn't even the one coming up with that idea. Well, I won't say who was, but this is too easy, I heard. No. How long did it take you?
Huh?
How long did it take you?
It took me like 4 times and I couldn't get over 17.
Well, let's work on. Whoa! That was 17, huh?
No, over 17.
Oh, over 17 points? Okay. Well, I'm sure we can always adapt it in the back end if you have. The midsection is the thoracic spine, is where the ribs connect. Those vertebrae have aerial surfaces that the rib attach. What? Oh, what are those surfaces called where the ribs attach? Costal facets, right? Huh?
Well, that's one of the answers.
No, that should be the only
Said
answer.
on the transverse
No, it's still
process.
Oh yeah, the rib tubercle. No, wait,
That's
that's.
not the rib typical, it's the faucet trans.
It's the faucet on transverse process.
Okay, yeah, that should be it. Let me make sure though. Oh, I'm getting hungry. Yeah, there you go. That's right. And then from there we go to the lumbar. So that was the thoracic. In the thoracic, you basically the rib cage. That's why it's the thoracic spine. The rib cage attaches to it. And then in the lumbar region, we got a large spinous process, and we got a large body as well.
Which one are we on?
19.
In 19, we got a large vertebral body, and you got a spade-like spinous process. You know, it was hard to make up questions for the spinal stuff because you got to sort of go into pretty good detail with it. Otherwise, it's all the same stuff. And then at the bottom of the spine, we have a structure that's made up of multiple fused areas. What is it called? You got one of those. Hold it up. Mine is back here. I gotta hold it up like that. There you go. That's my favorite bone. That bone is called the sacred bone because in old Greek mythology, they could hold it as and use it a little bit as a plate and burn stuff on it for sacred burnings. Not the human ones, they used the animal ones. And then on that bone, what is left is the spinous process, form ridges, structure going up and down. You can feel it yourself. What is that called? The structure on
Median sacral crest.
the median sacral crest. Good. And we don't have tails like dogs and cats. We have remnant structures. What do we call the remnant structure? The coccyx. That wasn't too hard, was it?
No, that was,
No,
That was okay, right?
when you get to the end, it was easy. Just split it out and
Oh yeah, I ran out of steam. Because it's hard to make these questions up, believe me. With that, we come to the rib cage, in the front of the chest, the breastbone. What is its anatomical name?
sternum.
The sternum. In there, what we have to know, we have the sternum is the whole thing. The top portion is its own name. It's called the manubrium. Then we got the whole portion is called the body, and then the bottom tip is called the xiphoid process. And I think that's on the test list, right?
yes,
I think so. And the xiphoid process is very sensitive. You have to be very, you can't poke it.
that kind of freaked me out.
Yeah, you have to be careful because what happens, that bone, I know it freaks me out every time. The diaphragm that goes from the back of the spine to the front, and it sits in there like a dome shape, like a parachute. It's attached to the xiphoid, and it's a muscle. And so as it contracts, it pulls on everything, and it goes down because it shortens that way. And then when that goes down, we breathe in air because the chest cavity gets big. That's the breathing. When you belly breathe, that's why you got to learn how to belly breathe. It brings the diaphragm down. Of course, the damn stomach goes out, and we all don't want to see the stomach, so that's the problem. But I know I'm getting a muffin top too. But anyway, when this breaks, the tendon pulls it back, and this thing on real bones is sharp, and it can pierce the liver. It will pierce the liver, and that's a problem. We don't like that. So that's why we have to be very careful of how we deal with that. And it comes into play when we do the Heimlich Maneuver. When somebody is joking, you do not want to just go like and break that stuff up. You want to go, Heimlich Maneuver, right? If somebody jokes, they can't talk. Because the air that goes up and down to vibrate the vocal cords is stuck. Because some food is in there, so you can't talk. So you have to go, when you do it, and they say like, ouch, that's so simple, I think. You take a fist and you cover the xiphoid and you go below it. And then from there, you yank. So you don't touch the xiphoid.
So you put your fist over that.
You put the first fist over it, you go below it, and then you grab it, and then you go like in and up, scooping. Because you want to squeeze that abdomen, so the force from the abdomen pushes up and puts the food through, that. Then you say somebody stand in front, take a picture, and then it flies right at. No, don't do that. Well, lucky people made it. All right, so that's good.